All right, thank you, everybody. So I'm starting off, and I think it's a good place to put my part because some of what I'm talking about are overarching concepts that really apply to a lot of these models and the approach to decreasing waste in the simulation lab. So I don't have any conflicts of interest, but I do have a strong bias towards decreasing waste. So one of the things that we do in our sim lab is proficiency testing for central line placement. I don't know if any of you do that, but this is the amount of trash that is generated if you just go ahead and test out somebody's central line placement without any thought towards reducing waste. And I put it next to a chair so you can see for size perspective. And if you ask me, this is sort of a problem. I love the idea of ensuring proficiency before we're actually doing a central line on a real patient, but maybe we can generate a little bit less garbage when we're doing it. So overall, if you want to reduce waste in simulation, I think one of the first things to do is to clarify your objectives. You can use simulation to teach a lot of different things, but answer for yourself, what are you using simulation to teach in this particular instance? And then which aspects of this procedure for purposes of simulation training are crucial versus which elements are not. A lot of the stuff that generates trash might be due to inessential elements, things that you can get rid of. Sorry about the formatting here. I don't mean to have all these dots, but you know how it goes. So some examples with a central line placement. Non-essentials are the opening of a brand new kit. You don't need to open a brand new kit every time somebody's training on it. But you have to be able to reuse the kit by putting the kits properly back together, because one of the essential aspects of testing central line placement is, can they set everything up in a sterile fashion? And in order to do that, you have to have the kit put back together properly so that they can open it properly without contaminating things. However, do you really need to open up a new set of EKG leads to apply every time? Probably not. I don't think we're really trying to test our residents' ability to apply EKG leads. Same thing with injecting lidocaine into the skin. By skipping the step that I think is non-essential for testing proficiency of injecting lidocaine, you can avoid generating sharps, broken glass vials, and it greatly extends the life of your CVL skin. Whereas proper draping, proper gloving, proper gowning, and probe cover application for your ultrasound, if you're doing ultrasound guided lines, these are all pretty crucial to ensuring that somebody can do sterile placement. So you're not going to be able to skimp on those. It's kind of hard to reuse sterile gloves, so some of this stuff is going to have to generate trash, but the drape is one of the biggest generators of trash, and you can reuse it if you know how to properly fold it. If you don't properly fold it, it ends up a big mess. It looks intuitively folded, but when you fold it the proper way, you can get it back into a kit that will be opened in a sterile fashion. And I don't know if anybody here ever tried to refold a sterile drape. Did you find it to be difficult? It's really difficult because if you try and fold it the way you would normally fold a sheet or a towel, it just doesn't work at all. What you have to do is a sequential accordion fold. So I've got a couple of drapes where we'll be able to practice the sequential accordion fold. It's really intuitive once you've tried it. You're basically just following the creases and doing what they tell you. But until you've done it a couple of times, it can be maddeningly confusing and difficult. So that's the reuse. How about repurposing? There are a lot of possibilities for repurposing equipment in the sim lab. I don't know how many of you are familiar with Trauma Man, but you get a lot of different equipment from it. So you've used a tracheostomy trainer from a Trauma Man to do a cricothyroidotomy simulation. You can't really do a bunch of cric sims on those, but don't throw it away. You can turn it into a tracheostomy troubleshooting simulator and then do some tracheostomy difficult cases and reuse it for that. What I'm going to show here is something I've used for the DPL skin. So I know Phillip said he's still doing DPLs at his site?
Yes, unfortunately.
Okay.
I keep saying dude a lot. I don't know why I keep doing that. But anyway, yes. Yes.
So I was surprised to hear that. We're not doing any DPLs for the most part where I'm working or the last couple of places I've worked. So we get, this package of Trauma Man skins and it comes with the DPLs. What am I going to do with them? Well, you could throw them away. But instead, we have turned them into a transvenous pacer simulation model. So rather than telling you how I do that, I'll show you how I do that when you come back to my station later on in the day. So basically, you take the DPL and some expired equipment. That's another tip. If you go down to your stores area of your hospital and ask them, what are you doing with your expired equipment, I found most hospital stores have an area in the back where there's a bunch of stuff that they've bought, we never used, now it's expired, so they have to throw it away. You go through there, it's a treasure trove of usable medical equipment for simulation education. And just using some expired equipment, a DPL skin, and any old monitor, I'll show you how to set up a transvenous pacemaker trainer. So in summary, reduce the amount of waste you produce by asking yourself, what is essential to completing the objectives of my simulation, and focusing on the essential aspects. Many of the things that must be disposed of in real patient care are reusable in simulation as long as you put them back appropriately so that they can be reused for the next learner while still achieving your objectives. And repurpose. Get creative with the things you have in the sim lab. If you ask me, that's one of the most fun parts of being a simulation-based educator, is that you get to express some of your creativity.